All right, hello everyone. Dr. Philip here again. You can call me Dr. Congratulations. And today I just want to talk about. Someone asked me about this and how many levels or um, types of doctors we do have available within Uganda, within our country. And so I'm just going to take a little while and try to run us through that. And so and before we go any further, please make sure you click that subscribe button and yes, and hit the alert bell so that you can be alerted with the consequent videos. From the very beginning, we know that doctors in Uganda undergo medical training for 5 years. Okay, so you undergo 5 years of training in medical school, and a doctor that has just finished medical school, a doctor who is fresh out of medical school, is then becomes an intern doctor. So that is the first level of doctors in the country. You have intern doctors, and these are doctors just out of medical school, okay, after 5 years of medical school. And the internship period basically runs for about a year. So it's a 12-month period of internship, during which the intern doctor then works under the supervision of specialist doctors. And you can find intern doctors just about in most government district or regional referral hospitals, and in private non-for-profit hospitals, which we call the PNFPs. Yes. And so after 1 year of internship, a person then gets, that intern doctor then gets registered with the medical council, and they become a medical officer. Okay, so full registration, and now free to practice medicine within the country as a medical officer. Usually, whether they're employed within the government system or in private system, you will commonly find them called the medical officers. And in other places you might find them referred to as general practitioners, more or less the same thing. And yes, so we have the intern doctor, and then we have the medical officer. Okay, and so above the medical officer, we have what we call the senior house officers. But take note that even within the space of medical officers, especially in the government system, you may have medical officers graded, let's say, on basis of their seniority, maybe years of practice. You may have the medical officer, the junior medical officer. You may have the senior medical officer or a principal medical officer, and these apply within the Ministry of Health system, right? So above that, you have the senior officers, senior house officers, who are doctors in training, specialist training. Okay, and so you've left the medical officer level, you've gone back to specialize within any field of medicine, whether it's general surgery, whether it is ophthalmology or anesthesia, it could be radiology, it could be obstetrics and gynecology, orthopedics, whatever specialty you might want to mention. But yes, you have the senior officers who are doctors in specialist training. So you have the intern, then you go to the medical officer, and then the senior house officer. And so when you complete your master's program as a doctor, you then become a specialist. And within the structure of Ministry of Health, those are usually known as medical officer special grade. Yes, and those are basically your specialists who have completed their master's training. And yes, so also recognize that within the different specialties of medicine, there could be so many other subspecialties within and all these doctors do specialize in particular or in different fields of medicine and acquire expertise in those fields of practice. Okay, for example, if someone is a physician, they could super specialize and become, let's say, cardiologist. They could become a nephrologist. Okay, they could become a neurologist, and all these specialize within a particular specialty. Okay, so those are subspecialties within a particular specialty, but at the end of the day, they're all specialists. And particularly for the structure of Ministry of Health, you will find that when a doctor becomes a specialist, beyond that, the medical officer special grade, you can then have what we call a consultant doctor. So a consultant is at a higher level than just a medical officer special grade. Okay, so you have your intern, you have your medical officer, you have your senior house officer, the master student, then you have your specialist, that is the medical officer special grade, then you have the consultants. And these gradings come with years of experience and basically lots of study and research. And yes, so you have your consultant who has years of experience in that particular field and lots of knowledge, so to say, in that particular field as well. And so beyond the consultant, you then have what we call a senior consultant, and the senior consultant is I think the highest level for a doctor within the Ministry of Health structures. And these are still specialists, and some of them super specialists in whatever field of medicine that we're dealing with. And so yes, beyond that, you could have doctors who are senior consultants who then go on to acquire professorship. So you can have a professor of medicine, so to say, in whatever specialty they are dealing with. And of course, these are usually awarded by the universities. So typically you'll find these are doctors that are attached to teaching hospitals or particular universities. Lots of experience, lots of knowledge, done lots of research, published a lot of scientific papers. And so yes, I think basically that's what we have to deal with. You have the different levels of doctors in Uganda. You have the intern, you have the medical officer, you have the senior house officer, and then you have your specialist, or the medical officer special grade, and then you have your consultant, and you have the senior consultant, and beyond that you can have a professor of medicine. Yeah, so those are the levels of doctors we do have in the country. All right, good night, y'all.